Hello guys, welcome to this channel. Today episode we are going to talk about the new pathways for international medical graduate and also the new commission to guide alternative pathways for state license of international medical graduates by the Intealth, which is the ECFMG, the new platform, the ECGME, and the FSMB. If you have followed me for a couple of months, you have known that I have a series that is called Job Auctions for International Medical Graduates in US. And this playlist or let's say series, it was inspired to a question that one of my friends asked me. She moved to the United States and she was looking for alternative pathways in the United States. And she was looking for information and gathering all that, yada yada, about the USMLE process and all of that, and the match process and the resident process and all that. And she was like, but what happens if you don't match? Because you have to spend a lot of money on exams, CV, and all of that. So what happens if you don't match? And I was like, this is a good question because the concept of general doctor. So, in some places, for example, in Latin America, if you don't want to do a medical resident or further studies, you can practice as a general practitioner or a general physician just with your medical diploma and also some requirements in order to get your license as a general doctor. Some places asking for a test, some places is asking for 1 year of house job. I know in Pakistan they do house job, which is like a certain like 1 year, I think so. In Latin America, it's called rural or general internship that you for like 1 year you practice under supervision, and after that you can apply for your license. And I know for sure in Latin America, you can practice as a general practitioner, which is like a general doctor, and you need your medical diploma and practice under supervision for 1 year, and after that you can apply for your license. So if you don't wanna do resident, is you're gonna be fine. You can practice as a general physician. But in United States, that concept it doesn't exist as people from Latin America and those places that I mentioned. Uh, that concept, to be honest, I mean, people from Latin America and also some places in different part of the planet have like that type of job. In United States, the general doctors, to my knowledge, the it's like a mid-level, let's say, healthcare provider, and the general doctor is the PA, which is physician associated or physician assistant, and the nurse practitioner. So those mayors are the one in charge in the part of general or mid-level healthcare providers. So the concept of like, oh, if I don't match, I'm gonna practice as a general doctor. It's something that is kind of complicated in the United States. The system is created for like you finish medical school and you got into medical resident, and after that you can work with your license. But now it's like that concept, like that interludio or like midterm. You are not a med school, but you are not a resident. It's not it's not that common in the U.S. healthcare because, as I said, the system was creating a way that after you finish your medical school, you got into medical resident or you get into medical resident. But what happened is, as international medical graduates, we have different stages here. Some of international medical graduates do all the process or mimic all the process as the U.S. system, and when they finish medical school, they are ready to go to get into medical resident and follow the same step as a U.S. Graduate. But most of us is not our reality, as it depends of the stage you are. But let's say some of us have different stages, and follow the U.S. system is not that easy. So you will find a bunch of international medical graduates or IMGs that study and take everything after the med school, and also you can find IMGs that do like the first stage, maybe a step one, and then they do all the paperwork, and then after they finish they do house job, they get a job, and then they keeping going with the step two, and then they do rotation and all that. So this is not a linear process. So in that interludio, there are a couple of INGs, or really a good amount of ING, that they are graduate, and they are getting ready for the steps, or they are finish a step, or something similar in that situation, and they don't get matched. Let's say also a group of ING, they finish everything at step one and step two, and they don't get matched, or they have a step one and a step two, but they want to work more on their CV and more that enhance the application. And in that interludio, that you are not medical graduate, you are like no med student, and you are not resident. So as international medical graduate, this is a popular question: what I can do, what type of jobs or facilities, or what I should do. So as I said before, if you live in United States already, you can work. For example, I have on my Instagram, I interview a clinical care coordinator. He's from Salvador, if I'm not mistaken, and he has spoke about his experience. You can check her out. You can follow me on Instagram. I have the same username. So you can work as a clinical care coordinator, also called care manager. You can call as a medical assistant. You can work on the research field. You can work in different type of job. But the option that is available is not as a physician practice with a fully licensed or a limited license as a physician. All the jobs that I mentioned are like side careers that are correlated to medicine, but it's not like you're practicing medicine as a doctor in the United States. So if you can see, and as I mentioned, I have a series of job auctions, and part of the and part of the what I'm saying. Oh my God, sorry. So, and what of the and one of the part of the series that I'm talking about is about um, like new opportunities or new pathways for international medical graduates in the United States. If you have noticed, since a couple of years, we had we have seen a bunch of news talking about possible new pathways, new laws, and everything related about new alternative for international medical graduates in different places, and also from U.S. graduates that for X or Y reason didn't match. So, but let's see. The first news that I was like, oh, something is happening here was the one in New York during COVID. So in New York, they create a license that you can have for 4 years, and after those 4 years, you cannot renew it. So you have a license that you can practice as a physician, as a primary care provider. I know someone from Pakistan that he was working as a primary care provider in Bronx, in New York, and he was working for 4 years. He was working as a primary care physician, as a doctor. He was under supervision, and he was practicing as a general doctor. You know, that concept that I explained a couple of minutes ago. He was working as a general physician. The only problem was after 4 years you cannot renew the license. So that was kind of the first time that I heard and something that I knew someone that applied and got it and worked and everything in that type of license. And then step by step I was like hitting and reading and all that, like that background that the healthcare system in the United States wants to create alternative pathway for international medical graduates. And then in Washington, no, Washington State, because remember, there is a Washington State and Washington, D.C., which is the capital. Washington State, no, Washington, the capital. They create a, a special license for international medical graduate. So if you're an international medical graduate and you have taken step one and step two, and also that is a popular question that people ask me sometimes when I make that type of video. Do I need the USMLE? And that is a popular question. Yes. In order to practice medicine in the United States, you have to take the USMLE. Remember, USMLE stands for United States Medical License Examination. That is the way you got this is the way you get your license in United States. You cannot practice until now without take the USMLE. You cannot practice as a physician in United States without taking the USMLE. There is a law, this is legislation, and you have to. There is no way you practice as a physician without USMLE. So for any opportunity that they offer, unless they change the law or they make an exception or they modify until now, the only way to practice as a physician in United States is take USMLE. I know in some places, for example, Spain. In Spain, you can get your license just with your medical diploma and some paperwork. You don't have to take any test for get your license. If is that C, so you don't have to take any license. So you can just apply and paperwork, medical diploma, transcript, and you get your license. But in United States, it's not the case. So in Spain, they don't do any paperwork for your license, but you have to take a test for medical resident. In United States, you take a test for your license, but you don't have to take any extra test for medical resident. And then yes, you have to take the USMLE in order to apply for this type of opportunities. As I said, it's mandatory until these days. And also, a popular question that I also people ask that I see in the comments, and also you DM me, guys, is like, but this is for, this is not for IMGs because they asking for citizenship or permanent resident or and yada yada. So there are different types of international medical graduates. So international medical graduates, it's someone that is studying medicine outside United States. It doesn't have anything related to your immigration status. You can be from, let's see, Nigeria, and if you study in United States, you are not an IMG. You can be from New York and study in, let's see, in Colombia, and you are an international medical graduate. International medical graduate, it's for someone that is study outside United States. Doesn't matter the immigration status. So depends of the state and depends of the legislation, because that's something like you have to keep it in mind. Until this day, there is not a universal, let's see, pathway for international medical graduate. So what we have already is like every, or let's see, a couple of states have created different pathways, but every pathway depend of the state is entirely different. The pathway in Washington is entirely different to the pathway in New York, and Tennessee, and Alabama it's entire different. So for example, in Alabama there is a special license, and it's called for international medical graduates license, and it's like a clinical license. In Tennessee, they give, and also in Washington, it's only 4 years. But in Tennessee, this license is orientated to get a permanent license after 2 years. I think after 2 or 3 years, you get a permanent license, and you can practice as a as a as a, let's say, general doctor in Tennessee. The one in Missouri that was created in 2014, that I'm creating a video about that one. They created a concept that is called assistant physician or assisting associated, with is like the term that is called for that mid-level general physician that have the USMLE but didn't get matched yet, or or they are waiting, they are like in that interludium, or in that phase that they are waiting and looking for opportunities, and they have their step one passing, step two passing, also ECFMG certification. Because that's also I saw something popular. Yes, oh, they don't ask for the USMLE, they ask for the ECFMG certification or certificate. I was like, yeah. So I that's something also say. Oh, they don't ask for the USMLE. They ask for the ECFNG. Yes, you cannot get your ECFNG certification without the USMLE. So in order to get your USMLE, I mean your ECFNG certification, you need to pass step one, step two, you have to take the occupational English test, which is the OET, which is a test that evaluates your medical English and is equivalent, is equal to C1 level European standards. And you have to apply for one of the pathways. So you need USMLE step 1 and 2, OET, apply for the pathways. So if they don't mention, sometimes they don't mention USMLE, but they mention ECFNG, it's the same. You have, in that case, yeah, I'm sorry, I'm in the middle of the street, like, I'm walking around. Sometimes that's why you can hear some noises. But yeah, sometimes they don't ask you for, or they don't mention, sometimes they don't mention the USMLE, but they mention the ESFNG certification. It's the same, because you cannot get, it's like in a cycle. You cannot get your ESFNG certification without the USMLE. So they don't say USMLE, but it's implied that you have to take it. As I said, you cannot practice as a physician, even if it's even if it's like under supervision. You cannot practice without the USMLE. It's not legal until this day, unless, as I said, they modify everything. But until this day, even if you practice under supervision, you need your USMLE. So that's something also I see a lot. But yeah, just go back to the, if you need to be a U.S. citizen for apply for these opportunities. So it depends. So it depends where you are going to apply. Because in some states you have to be a U.S. citizen or have a permanent status. Permanent status is someone that is legal in United States and have a work permit. So you can be a refugee, you can have a green card, you can have that type of special status where you can work legally in United States. So in that case, you can apply. So it depends. In some states say no, we need green card and U.S. citizen. So we need green card holder and U.S. citizen. In other place say no, we need. You can apply if you are a U.S. citizen, if you have a green card, if you have a work permit, if you are a refugee, if you have a work permit and you are legal in United States. In some places, for example, in Tennessee, I was reading because it is, I know in immigration lawyer or anything like that, but and I was reading in Tennessee's the law when I made the video because I have made a bunch of videos. You can check it out after you finish this podcast. I made different videos. For example, I made videos about the Alabama new pathways, Tennessee, Florida, and all that. But for example, in the Tennessee, the state, right? They don't sponsor visa. The government won't give you a visa for these type of opportunities. However, they said the hospital is the one that is going to sponsor the visa. So if you are an international medical graduate and you are like a non-USING, non-USING is an international medical graduate that doesn't have a work permit and a status or a, let's say, is non-USING is an IMG that doesn't have a permanent resident in the United States. So if you don't have a permanent resident in the United States, and if the hospital that you're going to apply is going to sponsor your visa, you're free to go. You can do the process, forget that license in Tennessee. So if, for example, you are a non-USING, you can apply in Tennessee if the hospital sponsor your visa. So you know what I mean? So they don't say, "Oh no, we just want permanent residence in U.S. Citizen." No, if you are a non-USING and the hospital sponsor your visa, there is no problem in that part. However, contact an immigration lawyer. That's gonna be really good. So in that case, is what I said. In that case, is what I said. And it depends. As I said, it depends where are you gonna apply, and you have also to contact that and see, your case and how it can work for you, and how that can work for you, depending of your immigration status. And so, as I said, I was like reading, like, for example, in Virginia, which I'm making a video also about it. In Virginia, they are creating a new alternative way. They are proposing a new alternative way. That was a new that I read a couple of weeks ago. Also, a month ago, I also was reading Florida. Florida has a license which is for underserved areas that is on, and they have different requirements. So you have to do different stuff. You can check her out after you finish this video because I have made a bunch of videos related to this topic. So I made a video about the Florida. Florida have a license for underserved areas. However, they want to create a new pathway for international medical graduate that doesn't have, for international medical graduates that don't have a resident, a medical resident in the United States, but they have passed USMLE Step 1, USMLE Step 2, and have, the ECFMG certification. So beside the special license that they have for underserved areas, they want to create a new one for international medical graduates, and also for international medical graduates and people that didn't match and have all their stuff, the ECFMG certification primarily. So, which is really good because Florida is in a state that have a bunch of IMGs from Cuba, Venezuela, Jamaica, Haiti, and there are really a good amount of IMGs in Florida. So it's gonna be really good and game changer for the IMGs community, especially the one that's living in Florida. And so and also Alabama create a pathway for international medical graduates, and also for U.S. graduates that didn't match. They create two different pathways. So as I said, it depends where you apply. So in this week, the ECFMG, which now, as you know, the ECFMG, which is the institution that regulates us, international medical students, the ECFMG have a new platform that is called Intealth, and also the state's license institutions and the general license institution for physicians in the United States have created a commission, have created like an advisors commission to guide the different let's say senators and the people that make the legislations and new pathways, because when they create a new pathway they have to modify or create a new law. So it's not just, oh, they create a new pathway. No, that's something that is a process that is involved senators and all of that. And the senators, some are like doctors, but they don't have that expertise in the international medical war and the physician license. So I guess they figured it out. That, oh, we need help, we need advice from the institution that are in charge with this. So they create a commission related to this topic, how to get to gather the right information related for new pathway for international medical graduates. So I'm gonna read the news and we're gonna discuss together that part. The Federation of State Medical Boards, InHealth, and the Accreditation Council for Graduate Medical Education announced today that they have established a new advisor commission on alternative license models to provide guidance on alternative pathways for state license of physicians who have complete training and or practice outside the United States. The majority of these physicians are international medical graduates, IMGs, encompassing both foreign nationals and U.S. citizens who complete their medical education and training outside United States and Canada. Approximately one quarter of the U.S. physicians' workforces is comprised of IMGs. IMGs are a critical component on the U.S. healthcare system and help ensure access to care in underserved communities. And physicians experience shortage, especially primary care. Some IMGs enter the U.S. healthcare system for resident and/or a fellowship training, have already completed post-grad training and/or practice medicine in another country. Despite substantial increase in U.S. medical school enrollment, a steady increase in U.S. graduate medical education, and reports that more than 99% of U.S. medicine and DO graduates and USMD and DO graduates enter training or full-time practice in the United States, current and projected physician shortage persists. There is increasing interest among state policies makers to improve patient access, and reduce workforce shortage by changing license requirements for physicians who have complete training and or practice abroad. Some of these proposals bypass certain requirements, including requirements related to U.S. postgraduate training that are designed to ensure physicians have acquired the necessary knowledge, skills, abilities, and attitudes to provide safe and competent patient care. While there are some shared characteristics among the proposal, there are also distinctions that may lead to a different outcomes across the states and create confusion related to physicians, regulations, and patients. In some cases, it's also unclear how medical boards and regulators will optimize the proposal pathways. In response, the Federation of State Medical Boards, the INHEL, which I said is the ECFMG, and the Accreditation Council for Graduate Medical Education, together with national organizations representing specialties, certification, and medical education, I'm working to develop meaningful recommendations for license requirements and pathways for international training and practicing physicians. This board has started, and the Commission is expected to issue recommendations and guidance and identify resources for states in the concerning month. We look forward to working with the states as implementing this proposal so that we have a consistent approach that protects patients and makes sure the readiness for this physician to practice in the medical healthcare system. So that was the announcement or the official statement of the Federation of State Medical Boards, the INHEL, aka the ECFMG, and the Accreditation Council for Graduate Medical Education. So it seems like this year is gonna be wild. So it's gonna be new changes. It seems like it's gonna be new changes, new pathways, and a lot of information related to these pathways. Maybe it's gonna clarify how it's gonna work. It's gonna be so. I have a couple of questions. They in the future they're gonna create an official pathway that is going to be unified, is going to be segmented as it seems like, because each state has its own policy and its own pathway. They're gonna have more requirements. It's gonna be more clearly. It's gonna be more clear for international graduates, non-US IMG. They're gonna create more alternative pathway for sponsorship visas and all that stuff. How that gonna work? So based on what is happening and what's going on, um, new changes are coming. are coming. And also a fun fact, as you know, I use the term general doctor, but that concept is not part of the game in United States, as we used to know in Latin America, for example. And and what I'm trying to say, so like that intermediate, like you are not a medical student, but you are not a resident, is called associated physician or assistant physician. That's something that is really popular in Missouri. In 2014, they created a pathway that is called assistant physician or assistant associated. Assistant physician is more popular, where you have your USMLE step 1, USMLE step 2, you have sort of clinical experience, and you got this type of license to work as a physician under supervision, and that is a mid level provider. and I was reading an article. I don't recall if it was in PubMed. I don't recall it was on PubMed or Metascape, but they was like make a like it was like they was saying in that article that that type of alternative pathway, mid-level pathway, is more like we have a function of nurse practitioner, which is MP, or PA, which is physician assistant, and the assistant physician is AP. And that type of alternative pathway, we have kind of the same scope as a MP and PA, like because MP and PA are mid-level physicians. I mean, not mid-level physician, mid-level healthcare providers. So maybe that's gonna be the name that they're gonna use for international medical or US that didn't match and have the USMLE and yada yada, associated physician or assistant physician. Because in some places like Utah, Kansas, Missouri, they call that type of providers as assistant or associated physician. Maybe that's gonna be the term that is gonna be popular, popping next the coming years. But yeah, I don't know when I'm gonna I'm gonna public I'm gonna make. So I don't know. No, what I'm trying to say, I don't know when I'm gonna public this podcast, because it's gonna be like, I don't know how long, because I feel like I have been talking for a while. It's gonna be a long video. Well, it's a podcast, so it means to be longer because I'm talkative and I speak a lot. But yeah, it's gonna be this type of news are really exciting because give you more alternative, and also in a really in a really metaphoric uh, way. My friend asked me, or she was like told me about his doubt, and the question that she asked me a while ago. Now we can see different type of choices and answers related to this international medical graduates journey, because the most important aspect is as international medical graduates we have choices, and if something goes wrong, hopefully not, but if something goes wrong or something, we have to be flexible or work on different part of our application before applying for increase our chance of matching. We have choices, or if you want to like practice as doctor as in Latin America, you have choices, at least in Tennessee, because in Tennessee they give you a permanent license. Because there's something in, so in some places they create pathways, but these pathways are for like, I mean, those pathways are like for like 4 years, and after 4 years, yes, you don't have choices to work with that license. However, in Tennessee, they create a pathway that you can get your permanent license. You have a permanent license in Tennessee after a couple of requirements. So I'm wondering, so how's gonna be the next step? They're gonna modify the part and they're gonna create pathways for permanent license as Tennessee, or they're just gonna have a seasonal license as other states? This is a good question. So I think this is the end of the video. I have been talking for years. If you stay until this point, thank you for watching, and thank you for spend a good amount of minutes on this channel. You can follow me on social media. This year, I'm trying to be active, well, more active. I'm trying to post at least one video per week. on Monday at 3 p.m. Easter time. Because some of you asked me, oh, banana, Easter time. At 3 p.m. At 3 p.m. every Monday. I mean, every Wednesday. I think I said Monday. No, every Wednesday at 3 p.m. Easter time, I try to post a video. I'm trying to be consistent here. And also, I'm more active on Instagram. I try to post, not retweet, I try to post stories and important like information over there around the international medical community. Um, and yeah, you can follow me there. And see you next video. Bye.